All 77 Oklahoma counties are now on a safer at home mandate through April 30th. And the governor has ordered a special session of the legislature to convene on Monday to greenlight his catastrophic healthcare emergency decree and the additional executive powers that go with it. Testing capabilities are increasing dramatically, and so are the number of people testing positive. 879 confirmed cases and 34 deaths in Oklahoma as of Thursday. And it is with that sobering backdrop that the governor and his task force updated Oklahomans this week.
As of today, the state of Oklahoma has 13,600 test kits available, and Oklahoma State University has opened up its lab and can do 2,300 tests per day now. Anyone with symptoms of COVID-19 or those who have come in contact with someone with COVID needs to be tested this week. Providers, healthcare officials, hospitals, county drive-through testing facilities. If you can hear me, please begin testing all of those folks today. Anybody that has symptoms of COVID-19, we want you to test them. That's the main point to get across.
The reason that we need to test is we do need to see both where it exists in the community, and we need to get the denominator of our math up. And that's really the call on the private labs, who to date have provided their positives, but not their negatives.
So it is very important that we both understand the negatives and the positives, and that everyone is reporting in. As we've talked a lot about modeling and the data, the tests are the data that help us see into the future. So testing more people is important, understanding whether that's positive or negative.
This week, Oklahoma received our full supply from our federal allotment in PPE. We must reserve the supply for those who are on the front lines delivering care to COVID-19 patients, hospitals with ICU beds, and individuals being treated for COVID-19 will receive more PPE when it's needed. Later today, we are also deploying much needed PPE to our first responders across the state.
We didn't rely simply on the federal government's supply. Certainly that's been integral to our effort. The Strategic National Stockpile, of which we've talked a fair amount, is our stockpile of last resort for our medical community and our providers. We have multi-million-dollar orders, for instance, of N95 masks and KN95 masks that will be arriving, the first of which is today. And then over the next 3 and 4 days, we will be receiving the first parts of those orders. Those were put out on the open market. It has been a competitive situation.
Again, the modeling at this point shows between 4,000 beds needed to 6,800 beds needed, depending on what model you look at. So we're going to plan for an early peak, but we're on a nice trajectory in case this thing peaks later. Ventilators, we're showing in those early peaks that we have enough ventilators in our state right now. If it does peak some of those later times, we'll need to acquire some other ventilators. But right now, we have 2,500 open beds in our hospitals across the state. I track that number every day. We've got ICU beds that are open and available. We've got excess ventilators. Next 3 weeks are going to be critical in Oklahoma, and that's why I'm letting Oklahomans know it is up to us to take care of each other, our neighbors, ourselves, and stop this spread so we can get through these next 3 weeks and get on the other side of that curve. But we're getting prepared for the worst. We're obviously praying and hoping for the best. But ultimately, at the end of the day, we have to take this seriously, Oklahomans. We've got to keep ourselves safe. But this is a personal responsibility issue. And in my opinion, I cannot shut down and bunker in place. It sounds good and it's kind of a soundbite, but it's unpractical for us to do a bunker in place for the next 30 days.